Flower Power Health is a concept and a company that I created to work on really better serving the needs of people who are not getting what they need out of the healthcare system the way it is right now. I've worked in healthcare for over 10 years. I've worked as a ICU nurse, I've worked as a family nurse practitioner, and I've seen a lot of people who go in seeking care either proactively because they need it or reactively because they've had something happen, and they walk away feeling like they haven't been heard, or they are confused about what to do next, or they feel judged, like they've been told, oh, you need to lose weight, or you have to exercise more, or you have to change your life. And instead of really feeling like they have the ability to take ownership of their health and what they want to do to feel well and to feel the way that they want to feel, they feel like they just don't know what to do next. And I think this is compounded by the fact that there's just so much information and misinformation about health that's available online that it can become overwhelming and confusing for people who really want to do right by themselves and who want to be well and who want to feel good and who honestly have things that they want to do in their lives that they want to be able to show up for, but maybe aren't interested in, dedicating their whole lives to health. They don't want to be those people who, take 18,000 supplements and spend 2 hours in the gym every day. They want to be, a teacher and really show up for their students. They want to be a, parent and really be there with their kids. Or, they're a leader in a social justice cause and they really want to be able to be present and effective in that role. And these people, they need help. They need support. They need to be listened to, and they often need a little bit of guidance. And that's not the same thing that they're getting when they go into the doctor's office and they get told, that they have to do certain things in order to meet the healthy people guidelines or whatever it is at the time. So what Flower Power is providing is really an individualized health support. It's evidence-based, it's holistic, and it's an opportunity to learn, together what's going to be the best way for each individual to get where they want to be health-wise. My approach starts with focusing on your strengths. So what are you good at? What do you care about? What are you passionate about? What are you doing well? And let's build on those things. I'm also very passionate about making sure that the care and services that we provide are inclusive. That's gender inclusive, it's religious, it's body type, it's socioeconomic, it's race, it's ability, all of these axes that people differ on, to make sure that what Flower Power provides is useful and accessible and affirming to different kinds of people. It's body positive, meaning that I respect and value the body that you have, that no body is good and no body is bad, okay? There's no stigma associated with weight or with disability or with gender, all of these factors of diversity that sometimes, not just sometimes, but often get sort of categorized as inferior, whether that's explicit or whether it's implicit, that we want to leave that outside and sort of work on building positivity around our bodies. And that we also have an anti-oppression stance. So, there are all kinds of axes on which our healthcare system, as part of the capitalist society that we live in, really perpetuates oppression, and to make sure that in the space that we hold at Flower Power Health, that everybody has power over their own lives. So that's the basics of what Flower Power is for. And then what we do, we offer coaching. So in some spaces, health coaching is sort of code for, here's how you approach nutrition and weight loss. And while we can support nutrition and health changes around nutrition, really what we want to do is broader than that. It's supporting healthy lifestyle changes and personal growth in ways that are really going to serve you in what you do. We also are able to support people who have more specific needs around healthcare. So whether that's that you've gotten a diagnosis and you're unsure what to do with it, you've done some Googling and there's conflicting information, or you want to know if things that you found online are really valid or what's going to be the right approach for you, or maybe your doctor that you saw didn't really give you any information or choices and just sort of shoved you out the door with a prescription and you want to dig into that a little bit more. So we can definitely support that. We can also help you prepare for medical visits, look over what labs and tests you've had, start to develop a list of questions that you might want to take back to the doctor or the provider who saw you, as well as work through answering some of them. And then also figure out, when you're there, what's going to help you get the most out of your visit so you can really develop a holistic plan. So those are some of the things that we can offer to individuals, and I'm really looking forward to continuing to grow this work and to have great partners and clients or patients or people who want to work on this model of care with me.